Please welcome Dr. Ranjith Puranik, who happens to be the CEO of Dudh Papeshwar Industries, and he also has been associated with the day-to-day activities of this Second World Ayurvedic Congress. So may I request Dr. Ranjith Puranik to elaborate his thoughts on the topic, Ayurveda for Future Industry 2012. Please welcome Mr. Ranjith Puranik. Give him a big hand. Thank you.
Thank you, Dr. Thomre. Our chairman for today, Dr. Vasu, our co-chairman and Guruji, Vaidya Shriram Sharma, mentors, Vaidya Devendra Tiguna and Dr. S.K. Sharma, Dr. Kuti, and ladies and gentlemen. Today I'm in front of you and I'm going to present a few thoughts on Ayurveda for the future, which is the theme of this entire Congress. And I have kind of made it a finer focus to bring it to what we refer to as how we can see or where our industry is headed and what is the kind of picturization of industry that we can have by 2012. Before we jump into the picturization, let us understand in 2006 what where the Ayurvedic industry really is. As per the annual report of Department of Ayush, there are around 7,493 licensed units manufacturing Ayurvedic products. The annual turnover of the entire Ayurvedic sector is around 5,000 crores, and it's estimated to grow at around 10%. The export of products, now I'm being a little choosy in terms of which exports I'm sharing with you. The exports of products put up for retail sales, I'm not referring to bulk herbal extracts, and neither am I referring to bulk medicinal plants that are exported, but when we talk in terms of export of products put up for retail sales is around 120 crores. GMP for the Ayurvedic sector was introduced in 2001, and with a lot of persuasion, a lot of culling, a lot of training, today we can say that almost 90 to 95% of the Ayurvedic licensed units in India are GMP compliant. When we take a look at the market, we're talking of a market that is divided in three distinct segments. We're talking of the largest segment being the over-the-counter products, or the OTC products, which are generally what we also call them as fast-moving consumer goods. Then we have an entire section which is the prescription products, where mainly Ayurvedic physicians and some of the modern science physicians are actually prescribing these products. And then, of course, we have the ancient tradition of classical products that is also patronized. This is as far as the market goes. When we talk about the annual health expenditure, we're talking of around 361 crores, of which the direct support to industry is a little above 5 crores or so. This is the status as on today. We have the National Medicinal Plant Board with an estimated budget of around 45 crores per annum. And as per the latest report 2006, the National Medicinal Plant Board also talks of having almost 70,000 acres under cultivation. When we talk about dream a dream, even Dr. Mashelkar mentioned that we must dream. And if one has to really dream a dream for 2012, what is the kind of picture that we get? We would probably have the same number of units. 7,000 plus minus licensed units is what I see, because I don't foresee a great many new entrepreneurs, new units raising the number of units. There's going to be an intense churn, because even in India we know that the competition has increased manifold, and towards this we would see that the licensed units would be in and around 7,000 itself. But when we're talking about the annual business, you can talk about or estimate a commerce of almost doubling to 11,500 crores by the year 2012, registering a growth rate of between 18 and 20% for the entire sector. This is my vision of 2012, something that's absolutely plausible and possible. We can also think of a tenfold increase in exports, going up to almost 1,200 crores. Again, I put a rider right here that these refer to exports which are for products put up for retail sales. In the next 5 to 6 years, we can also talk about a GMP, Schedule T, version 2 being introduced, a slightly more upgraded GMP than the one we have today. And you would also have, within the Ayurvedic industry, units complying with international guidelines like CGMP that is given by WHO, as well as GMP specified by Dietary Supplements Act in the US, as well as the HACCP Act, which is a worldwide phenomenon for food units. When we talk about the Ayush budget, with whatever discussions that have been ongoing for the Planning Commission's 11th plan, we see the budget for Department of Ayush also escalating to almost 900 crores, and we are hoping that the industry also gets a support of almost 200 crores per annum. Also on the plans is the support for the National Medicinal Plant Board, which budgetary estimates also indicate that the support would go up to almost 120 crores, and the milestone deliverable that has been stated talks about something like 250,000 acres coming under cultivation of medicinal plants. Now, let's understand the Ayurvedic market, how it's divided today. As I mentioned to you, in 2006, we have OTC at around 3,600 crores, ethical products at 750, we have classical products at around 500 crores, and exports at around 120 crores. In 2012, how would this market paradigm shift? We can estimate that the OTC products will almost double to 6,000 crores. You would have a prescription product also increase to almost 1,500 crores. There would be a great surge in the use of classical medicines to almost 1,000 crores, but the real surge would come in with 10 times manifold increase as far as exports of products put up for retail sales go, as well as you will see a fine differentiation between what we have today classified as the OTC products. You would see two new categories coming about, that is the food as well as the cosmetics. Now, that leads to what we refer to as an entire market scope of 10,700 crores. Now, what this future scope really means is that fundamentally, the patronage for Ayurvedic medicines within India itself will increase. We are already seeing the boom right here. This conference is also a witness to that, where I believe the organizers have even stopped the registration because they've crossed the number of 3,000. So this is the kind of response that the sector is going to get. And we are also going to see a great differentiation, a maturing of not only the sector, but even the markets. And the key factors that would bring about something like this is professional marketing. That is one thing that the sector is going to be getting. A lot of talent is already moving within the sector, within companies, and we are also already seeing that a traditional marketing approach of being a supplier to the market versus one who generates demand is also something that's already come into the sector, and this is something that we're seeing. As I mentioned to you, medicine also will get bifurcated into food and cosmetics. There is a minor amount of change that we estimate that would go into the Drugs and Cosmetics Act, bring about this classification change, which will also surge this kind of volume to support a commerce of 10,700 crores. And modern science doctors have been patronizing Ayurvedic medicine, but we also expect more and more like-minded doctors, even though they are allopathic doctors, we expect their patronage to come, and this is also naturally a growth booster that we can see. And the most important, which we'll be dealing later on in my entire discussion, would be the paradigm shift in terms of the health policy. When we talk about what I would like to now do is go into some very specific picturizations as to how the industry character would look in the year 2012. Today, GMP Schedule T is still 85–95%, but tomorrow, GMP, which is world-class accreditation, as well as ISO theorem in manufacturing as a matter of discipline, is something that would become just a fundamental norm. This is a transformation that we are seeing, we're witnessing, and this is something that will certainly take place in the next 5 years. Within the manufacturing sector, within the industry sector, you're going to see an entire strata of vendors as well as outsourcing possibilities that are going to also increase, and this is going to further fuel the marketing muscle of companies as well as also allow just marketeers to enter the market. Within the technical prowess, you're also going to see a development of a standardized Ayurvedic drug master file. This is also something that's on the anvil, a compiled dossier that talks about quality of medicines. Industry is also now going to be not just talking in terms of having herbs in their medicine, but industry is now going to start talking about the level of active ingredients that the medicinal plant input that is going within the in the medicines. This is going to naturally increase the quality quotient of the medicines, and we feel that there would be a much better demonstration in terms of activity that we can look forward to. Lots of companies today are clinically trying and conducting validation trials to their products, and we believe that there would be many more blockbusters coming in the next few years. And what we are going to see is a therapeutic segmental dominance. When I mention something like this, Ayurveda has great cures for ailments like arthritis, whether it's rheumatoid or osteo. Ayurveda has demonstrated great amount of prowess in combating diabetes, immunomodulating, oligospermia, and various therapeutic segments. And that's where you're going to see even the modern medicinal practitioner who is going to rely on Ayurveda, because he's going to get his entire fill of technical validation and technical support. So this is something that we see happening there. What we today also witness is the entire new generation of Ayurvedic physicians who are enthusiastic and who have come on board. And these are physicians that hold the hope for classical Ayurveda, where this entire segment also should see a great amount of surge after almost 3 decades of a flat growth. Whatever are the dictates, whatever are the criticisms, whether they're JAMA paper or modern science having certain queries about bhasmas and metallic toxicity, we believe with the kind of projects that are underway, we are also going to have firm replies to the various anti-Ayurveda and the anti-Ayurveda propaganda that has been carried forward. And these kind of firm replies is also going to increase the confidence whereby the commerce should be boosted. We are also talking about corporations entering the healthcare services, whether it's Panchakarma clinics, whether it's hospitals, or whether it's a chain of healthcare centers, and this entire trend is going to grow. These real growth drivers towards the entire business. Moving on towards the key driver to commerce, which is R&D. This is where I'll take time and mention to you that modern science defines R&D as business-driven R&D. Whilst in Ayurveda, the paradigm would be slightly different. It would be business driven by R&D, and that is where the entire repository of wisdom lies in Ayurveda, which would come to the aid of Ayurveda. We've already spoken about bhasmas, developing themselves into platform technologies, and these are platform technologies that will have immense potentials. Ultimately, we're going to talk in terms of validation of standard, safe, and effective medicines and technical dossiers to prove something like this without doubt. Today, when we take into account certain amount of a uniform trend that we see in Ayurvedic ethical products, that is, I term it as tonicology, because you have one hepatoprotective that practically does everything within the entire hepatic protective therapeutic segment. But this is the time in the next few years that what's going to emerge is super specialty products. Products that have demonstrated action, products that are very finely tuned to give that particular delivery of cure that the practitioner really expects. We are also going to see the coming again, or back to the future, if we can call it, of the Ayurvedic ethos. And by this I mean, when we talk in terms of classical medicine, we are talking of a therapy approach for a chronic or an ailment. We are not really going to talk of one product which is the blockbuster. And that's also something that we can see that R&D is going to bring forth in terms of validation towards a therapy approach rather than just a product approach. I won't go into mandate for Ayurveda, because Dr. Mashelkar and every eminent speaker in the morning has talked about how the mandate would be given to multidisciplinary scientific institutions to ensure that their focus remains in terms of Ayurveda and also moves forward. Exports, tenfold increase what I mentioned to you, and that is really tapping the global opportunity. Next week, we are having an international conclave in New Delhi, where we are inviting members and delegates. It's hosted by Department of Ayush and NISCARE, but we've invited delegates from the APNET, BIMSTEC, SAARC, ASEAN, as well as the CIS countries. Now, these are drug regulators, these are policymakers from these countries invited into New Delhi for an entire conclave to discuss as to how a mutual cooperation should take place. This also means that India would give recognition to their traditional medicine and mutually they would also be allowing our medicine. Now, I believe all of these efforts orchestrated in a firm plan can also lead to a great amount of increase in terms of exports of Ayurvedic medicines. That's the reason why I estimate that the exports of Ayurvedic medicines would go up tenfold. We are also going to be talking about a very key element of the Ayurvedic sector, or rather the core of the Ayurvedic sector, the Ayurvedic physician being allowed to practice not only in neighboring countries, but also in other countries. And I believe that this development will pave the way in terms of motivation for the new or the young generation of Ayurvedic physicians, and will also pave the way for companies to put their best foot forward in taking classical Ayurveda global. We are also going to be talking about global joint research programs, whether it's safety studies, or whether it's clinical validation of products, or whether, who knows, maybe even with NIH, to take into account whether an entire therapy can be accredited in terms of effectiveness. Blockbuster drugs are a must. The global health burden talks about HIV, malaria, and fever. Traditional medicine all around the world has been tapped for solutions. I believe Ayurveda also will be tapped. Ayurveda will be given a chance, which will lead to blockbuster products towards addressing this global burden that is really rattling nations and societies. And whether it's malaria, fever, or HIV, these are things that will come about. There is today a lot of negotiation between DSHEA and the European Union officials, and somewhere we estimate that we will see a great amount of acceptance of Ayurveda also. The nodal agency for all of this growth, especially in the next 5 or 6 years, is going to be the government. And regulations as a tool to progress is something that we can see. Dr. Sharma has talked about mainstreaming of Ayurveda, which I'm sure he'll come into his speech again, as well as, very importantly, Ayurvedic Pharmacopoeia of India and Ayurvedic Formulary of India being accepted globally. These are things that will really come about. Regulations as a tool to progress. We are talking in terms of classifications of food and cosmetics that are dealt with, as well as transparency in laws. Today, Ayurvedic sector has not been really recognized as a stakeholder, whether in the forest or the wildlife or the biodiversity. And I believe that that is something that will also change. Efforts are underway to ensure that something like this happens. And lastly, the role of Ayurvedic practitioners will, because they would be received in Indian society to have a deeper impact. The Ayurvedic practitioner, frankly, does not know seasons, and he doesn't recognize November, December, January as being the healthy season. The Ayurvedic practitioner is a 365-day clinic and servicing society even today. And I believe that the Ayurvedic practitioner will now not only get the chronic ailment patients, but will also be in charge of primary health care, that is at the GP level. That's something that's really going to come about. Hopefully an educational reform that reflects the true Guru Shishya Parampara also. That's something that will come about. In terms of resources and with the efforts of National Medicine Plant Board, we can look forward to times of plenty. I won't go into all of these details because there is shortage of time, but I will talk about a good governance. This is where industry and all stakeholders of the Ayurvedic sector are going to have to partner with the government and come out with what we refer to as good governance that leads to better practice of Ayurveda, defines a mature market for the products, talks of development in the industry, leads to an involvement of multidisciplinary scientific approach, leads to times of plenty of inputs, and also taps the global potential. This is what I foresee in the next 5 years that will come about. And lastly, sirs, even though what I have shared is a vision in the next 5 years, believe me, the golden era for Ayurveda has just begun. The issue is, even in 2012, we would have just been at the takeoff stage. Aspect is, India is foretold to be the world's second largest economy by the year 2048. So please rest assured that all things Indian, all things core and supremely Indian like Ayurveda are going to see the golden years coming forth. And I think we can really look forward to the next 50 years of great amount of growth and surge. And it's about time Ayurveda had its resurgence. And these are very exciting times, and I'm happy to be at even the right age to ensure that we dovetail the entire progress and realize the potentials. Thank you.